for today. Will that be okay with you? Okay, can I please have your wristband for me to verify your identity? Can you please state your full name?
Joseph Miras,
Okay, how about your birthday?
first 11,
The year?
2007.
Perfect, thank you so much, sir. So I've checked your records and physician ordered me to do vital signs taking and Tepid sponge bath with you. But the first thing that I need to know is to check your temperature if you're still in the fever stage, okay? The purpose of our vital signs taking, sir, is to observe your general health status. And the purpose of our Tepid sponge bath, sir, is to lower your body temperature as well as to promote circulation and elimination, okay? Now, before we start with the procedure, sir, would you like to empty your bladder first? Gusto ka mo void daan? Use the toilet? Dili lang. So, please tell me, sir, if kaihion ka because we have our urinal in here, okay? So, what language would you like me to use? English, Bisaya, or both? Both lang. Okay. So, I will be providing you with privacy, sir. I will be closing the door. And I will now be doing hand hygiene for infection control. And I will be preparing my equipments, okay? First thing that we'll be doing now is your vital signs taking, okay? So we'll be starting with your temperature. We'll be using your axilla. We'll be getting your axillary temperature. Kabalo lang kamo gamit sa atong thermometer, sir. So, hold this for me. Can I check your armpit kung gabasa ba ang ilok, sir? Okay, very good. Put that on your armpit. Turn it on. Pinduta. While taking temperature, get patient's pulse and respiratory rate. Okay, thank you so much, sir. Temperature is 38 degrees Celsius. Respiratory rate is 16 cycles per minute. Pulse rate is 60 beats per minute. Next thing that we will be doing, sir, for your vital signs is that we will be checking for your blood pressure, okay? Select appropriate arm. Straight lang, sir. Relax lang, sir. Okay? Do not allow clothing to interfere the cuff. Wrap the cuff around arm smoothly and snugly. Palpate the pulse. Tighten the screw valve in the air pump. Inflate the cuff while continuing to palpate the artery. Okay, so blood pressure, sir, is 177/77, okay? Pila gani ito, sir? Pila to? 177/77. So that's normal for your age, sir, kay 13 pa man ka. Okay? So wala lang tayo problema sa imong blood pressure, sir. Dili lang ta sa imong temperature. So because you're having a temperature of 38 degrees Celsius, we will be proceeding now sa atong Tepid sponge bath, sir, ha? Okay lang? Okay? So I will just record our vital signs findings, okay? I will be doing hand hygiene again, sir, for infection control, and I will be preparing my equipments for your Tepid sponge, sir. So, can you please cross your arms and legs for me? Balik na, sir. 3, 2, 1. Put on bath blanket to top sheet. Can you please hold this? Remove top sheet. I will be removing your gown, okay? Can you do it for me? Or maglisod ka? Maglisod. So, cross your arms again, sir, and your legs. Okay na, nakakross na, sir. Remove patient's gown and put it in the hamper. So, I will be pouring my water into our basin, sir, ha? Okay lang? So this is warm water. We'll be placing this bath towel in your chest. Submerge washcloth and put under each axilla. Also put a washcloth on the groin area. So I will be submerging our third cloth. And I will be sponging my patient's face. But before that, I will be making a mitt first. This is how you do a mitt. Okay, then fold it, insert it. Okay. Okay, so I will be sponging my patient's face. starting in the eyes from the inner canthus to the outer canthus. Tap to dry using bath towel. Let's make another mitt, and we will be sponging our patient's remaining face from the forehead going to the nose, forehead to the cheeks, to the ears, and to the neck. After sponging patient's face, sponge further arm using long even strokes. Sponge nearer arm using long even strokes as well. Pat to dry and sponge the other side of the arm. Next is we will be putting our bath towel in here, because we will now be moving to the chest, to the abdomen, and to the thigh of our patient. Next is we will be doing the back of our patient. We'll be removing this wet cloth in our patient's axilla. And also, we'll be removing the wet cloth in his groin area. Put this on the hamper. Assist patient to put on gown. Put on top sheet. Remove bath blanket. Assist patient to side lying position and remove waterproof pad. Okay, sir. So we are done with your Tepid sponge bath. How are you feeling?
Okay na.
Okay na. So after 30 minutes, sir, I will go back to your room to check your temperature again, ha? And I will be doing my aftercare sa akong equipments and hand washing, okay? Thank you so much, sir, for your time. Nakay questions para nako, sir.
Lara.
Okay, so after vital signs taking and Tepid sponge bath, do aftercare to the equipments and perform hand hygiene for infection control.